All right, and now we're back, getting ready for the treatment. So before we get going, Lisa, what would make me, a good patient for this, a good candidate?
So great Kybella candidates are people anywhere from 18 up, there really is no age cap, that are concerned with the fat that accumulates under the neck. Could be very little, where we're doing more of a preventative treatment, or a lot. We have some patients that have come in that probably really were surgical candidates and have had great results. You just have to buy into the treatments. For any patient, including Angie, which you've seen the area we're going to treat, we like for you to prepare for 2 to 3 treatments minimum. Now, if Angie comes in, she's happy with 1 to 2 treatments, she by no means is bought into a 3rd or 4th. However, we'd like to prepare you for more, and then if you're happy, you're good. So anybody who's got the little pocket of fat here, you're a great candidate. We do caution those who have any difficulty swallowing, history of or current. Anybody who's had previous neck surgeries, and you definitely want to let us know if you have any kind of thyroid disorder. So they don't rule you out, but they're very important for us to know.
How does this work? Do you inject something that makes it dissolve? Do you pull the fat cells out? How does this treatment actually work?
So this medication is actually, and hopefully I pronounce it right the first time, deoxycholic acid. It is a naturally occurring bile acid in the body. When you eat a fatty meal, it's what your body produces to break that up. So over the next 6 to 8 weeks after we inject Angie, the medication goes in, starts working immediately, dissolves the fat. They say it's not specific to the fat, but it works best there. And this has to do with proteins, but that's neither here nor there. It breaks the fat down, your body naturally gets rid of it. So there's a little bit of swelling like we said before, but there's no downtime.
Now, is this treatment, does it work better for men? Does it work better for women? Or is it just kind of like, it works awesome for everyone?
It works great for everyone. I haven't seen better results with one sex or the other, with younger people versus older people. It seems to work across the board. So.
Okay, and is this something I could just come in and do on a lunch break, or do you need an hour to do it, or how soon can it happen? Can I be in and out?
If you'd like to come in for a consult, because consults are free, we discuss pricing, side effects, things of that nature, your medical history, I like to have an hour. Now that includes enough time for us to actually do treatment. You'll see here, treatment is very, very quick. In fact, the whole procedure itself might take 5 minutes as far as cleaning and doing the procedure and anti-icing, and you'll see all that. So the procedure itself, if you've done a consult, maybe 30 minutes, you could come on your lunch.
Okay, well, I don't want to hold you up anymore, so let's go ahead and get ready for this procedure to get done.
Okay, so if you'll take a look at Angie, we've already prepped Angie. She's been cleaned, she's been marked, Angie's looked at it, I've looked at it, we've agreed this is the area of her concern. Angie does have ice. Angie, will you hold the ice? I do this for all patients because a lot of people are concerned about pain. This is the only thing I find necessary. I have done hundreds of patients with Kybella, and this works for everybody from someone with low pain tolerance to high pain tolerance. Angie will kind of describe that after the fact, but I go ahead and give it to you because it is so quick and I like you to have it. But we're going to get started here, Angie. So just lay your head back, relax.
Now, Angie, if you would, while this is happening, I don't want to mess her up with injecting, but let us know how it feels.
Okay. Most patients do actually talk during the procedure. It's kind of scary at first, but they do well. So, Angie, I'm just going to pinch here.
Mm-hmm.
Deep breath.
Mm-hmm. Barely felt.
What would you compare it to?
Botox.
And it is the same size needle that we use for Botox injections.
I really barely feel it.
And Angie's not had anything to numb her.
Nope, I didn't even use ice before.
She's not pre-medicated with any Tylenol or anything. We're already halfway done with her treatment. And this is very typical size too. Pricing can run anywhere between, let's say for a smaller area, $400 to $500, all the way up to $2,800 if we did a full dosing on someone. Typically that's more your male patients because they've got wider jawlines. Angie, how you doing?
Good.
Now, how long would Angie need to wait for her second treatment?
I like to see patients at 6 weeks. Angie's totally done. If you want to apply the ice, you can. How do you feel?
Good. It's a little bit of burning. Other than that, The sticks were nothing. They were just like Botox sticks, really quick. Just little stings, really. And then they were done. And right now it's just burning some. It's not horrible, but I know something's in there. I can tell it's going to swell, which we want it to swell because we know it's attacking that fat and breaking it down. And we get some of the tightening is conferred from the swelling. So anytime your body has inflammation, the skin helps to repair that inflammation by building collagen, which is always a good thing, right? So I'm not going to go home and take any Benadryl, any antihistamines, nothing to take the swelling away. I want it to swell. I know it's doing its job, and I know I'm going to get some skin tightening from that swelling. Swelling's going to probably last 3 to 5 days. Is that what you're seeing?
That's at its worst.
And I think the first treatment we do on people, the swelling is its worst. After that, subsequent treatments aren't quite as bad. You don't have as much fat left to swell as much. So,
Angie, can you take the ice off so
Yep.
they can kind of see? So, Brent, if you can come in, look straight ahead like you're looking at Brent. Angie's pretty swollen. I don't know if you can tell, but that is about where she's going to be for the next 2 to maybe 4 days. It doesn't get too much worse than this. Her worst day will probably be tomorrow. Then she'll kind of go back to normal. That's what patients should expect. And it takes 6 to 8 weeks to see your full results from one treatment. So that is why we bring you back at 6.
and the burning's already easing up some. So once this initial stinging goes away, people tell us there is no more pain associated with it. You just have some residual inflammation, which we expect and we know will get better. Maybe a little bruising. Most people not, but you can have some.
And you're saying for the people that are a little scared of the swelling, they don't want to look that swelled up in front of their friends, wintertime's coming. So what are some tips people could do to hide the swelling? You know, would a scarf work? Would a turtleneck
Scarves
work?
definitely work. I will tell you, the first patient I ever did was around Thanksgiving last year. She went out and did all her shopping, even without a scarf. The swelling, of course, is going to be worse to the patient because they feel that there. Part of the chemical reaction that takes place, a byproduct, is water. So if you can imagine a pocket filling with water, the patient kind of feels like they've got a big, thick, watery neck. So it's always worse to the patient. Most people are not going to recognize it as swelling. They're gonna say, oh, she's just got a little bit of fuller neck. So it's not anything that would keep you out of the public, out of work. Your significant other will notice. Your kids may notice. Your best friend. But other than that, a lot of people aren't going to notice.
Okay, well, awesome. In closing, is there anything you would like to say, Angie?
No, I mean, I'm almost back to normal. Feels good. Thank you for watching again. We appreciate you guys.
Right, and
Thank you.
all right, well, awesome. Hey, if you want to get some before and after photos, want to get a description of the products, just check out our Facebook or our website. Also, we got a new YouTube channel, and we'll be uploading this to that. Thank you again for tuning in, and send any questions you have our way. Bye.